Hello, my geniuses. Welcome to another physiology lecture series today. It's your great sciences of Lorenzo, and today we'll be talking about circulatory shock. Okay, so it's a very important topic clinically, especially for those that are practicing and for those that are building to become medical professionals, like in every department. So it's very important. And if you are preparing for any professional examination, this topic is also important because any reduction to blood flow in the body push the patient into shock. It could be a reason from anything. So if you are new to my channel, make sure to subscribe and turn on your post notification button, and I want you to stay to the end of these videos because you understand, because I'll be giving step-by-step reason. I will explain. You will see how I flow with it to be very easy for you to get. So stay with me to the end of this video. So, and if you want me to make a video for you, drop it down in the comment section. I promise I'll make that video when I see it. So let us jump right into the video. So the first question we'll ask ourselves: what is circulatory shock? Circulatory shock. So what is circulatory shock? It is a clinical syndrome resulting from the failure of the cardiovascular system to meet the demands of the body. So what does the cardiovascular system do? They pump what? Oxygen. They pump blood, because blood contains oxygen and nutrients. So when the supply to the tissues, which is the oxygen and nutrient required by the tissues, when they are low and the heart cannot meet the body's demand, the body will be made to enter into what? Shock. So circulatory shock, it's a clinical syndrome when the cardiovascular system cannot supply oxygen and nutrient to the tissues. So when they cannot supply, what will happen to the tissues? The tissues will become what? Hypoxic. So there will be hypoxia, there will be organ dysfunction, and if there's no resuscitation after some time, what happens? There will be death. So number one thing is a clinical syndrome when the cardiovascular system or the circulatory system cannot meet the body's demand on oxygen and nutrient. You get that? So simple. Circulatory shock. And when the cardiovascular system or the circulatory system cannot pump enough blood, they can supply enough nutrient, cannot supply enough oxygen to tissues. Are you getting me now? What happens? The tissue will be damaged. Are you getting me now? So they'll become hypoxic, there'll be build-up of CO2, they become acidotic, and what happens? They will start dying. They'll become ischemic, become necrotic, and they'll die. You get that? So the next one is the features of the manifestation of what? Circulatory shock. So what are the features? What are the clinical features you will see when there's circulatory shock? One, due to the cardiovascular system cannot meet the body's demand. One, there will be reduction in cardiac output. So there will be reduction in cardiac output as this case. Why? Because if there's an increase in cardiac output, which means that the heart will be supplying blood successfully to all tissues. So cardiac output is the ventricular output when the ventricles is supplying blood effectively to the rest of the body. So if the pumping action of the ventricle reduce, which means the ejection fraction will reduce, which means the cardiac output will also reduce. Also the stroke volume too. So a reduction in cardiac output will result to a reduction in what? Stroke volume. And when the cardiac output and stroke volume is reduced, which means the tissues are not really receiving any blood. Two, hypotension. Why will there be hypotension? Why? Because hey, at this particular point, the vesicular diameter will reduce. Are you getting that? So naturally, if there is high increase in vascular resistance, what happens? There will be increase in what? Tension in the wall of the blood vessel. But due to the fact now that the tension in the vascular wall of the blood vessels have reduced. Why? Because the body is trying to compensate. The body is trying to compensate because there's no more blood. And since there's no more blood, the cardiac output has reduced. What happens? The vascular resistance has what? Also reduced, which means there will be the diameter of the blood vessels will open. You get that? The diameter of the blood vessels will open, causing a reduction in blood pressure, causing what? Hypotension. And at this particular case also, the body is trying to shift fluid from the tissue to the blood. Are you getting me now? So there will be movement, capillary shift exchange, whereby there will be movement of fluid from the tissue to the blood, so that at least the blood volume will also reduce. And this movement causes a widen, so there will be permeability of the vascular capillaries. So due to this widening of the vascular capillary, what happens? There will be widening of the blood vessel, which drops the vascular resistance, which drops the tension. You get it now? So that is very important. One, there will be reduction in cardiac output, reduction in stroke volume, and also there will be hypotension. So now what happens? There will be tachycardia. They call it what they call reflex tachycardia. Naturally, the heart rate is supposed to be low, which causes the cardiac output to be low, which causes the stroke volume to be low. Because what happens? Cardiac output is equal to stroke volume times heart rate. But at this particular point, due to there's hypotension at this case. Why? Because the venous return is reducing. The venous return is reducing because there's low amount of venous pressure to push blood into the right atrium. You get it now? There's low amount of pressure. So since there's a reduction in venous pressure, there will be reduction in venous return, which causes a reduction in cardiac output. So at this particular point, what happens? The heart rate will increase. We call it a reflex tachycardia because there will be an afferent signal sent to the medulla so that there will be an increase in heart rate. So this increase in heart rate is telling your body to what? Utilize a small amount of blood to pump it out fast. Are you getting me now? So there will be reflex tachycardia. Are you getting me now? Also, there will be signs of hypoxia. Why? There's signs of hypoxia because now there's tachycardia. The heart will now be beating too fast. If the heart is beating too fast, it will now be consuming all the oxygen that is having instead of the heart to rest. It is not resting. It is beating too fast because of tachycardia. Heart rate. The signal from the SA node is high. It's firing. So the myocardiums are contracting excessively, utilizing the oxygen there. So as far as they are utilizing the oxygen there, what happens? It is dropping the oxygen level. And it is dropping the oxygen level. So when tissues uses oxygen, do you know what they are happening? As they are using up oxygen, they are converting them to CO2, which means there will be high buildup of CO2. So when tissue uses oxygen, what happens? They give a waste product called what? CO2. That is very, very easy. So now there will be tachycardia, excessive contraction of the heart. There will not be what? Hypoxia, which means the oxygen used up by the myocardium will be high. And the byproduct of oxygen is what? CO2. And when CO2 combines with water, it forms carbonic acid. And when it forms carbonic acid will share into bicarbonate and what? Hydrogen ion, causing what? Acidosis. So there will be acidosis in the tissues, causing the lactic acid level to be what? Increase. That's why if you check the lactate in as the cardiac enzyme, if you do a cardiac enzyme checkup, what happens? You see the lactate level of the heart will increase. Also the ALT level and also the lactate level will increase. Why? Because the heart is contracting, no oxygen. So instead of it to go from pyruvate to acetyl-CoA, to be moving to what? Lactate formation. There will be pallor. Why? Because there will be paleness of the face due to less movement of water. The face will be pale. There will be cyanosis now because now remember you need pressure to push blood to the tissues, extreme peripheral tissues like the arms, the legs, the tongues, the lips. These are distant tissues that are far away from the body, so which means you need high amount of pressure. So due to a reduction in vascular resistance, no pressure is enough to push this blood to the rest of the tissue, so there will be cyanosis. So you'll be seeing the patient's hand will be blue, you'll be seeing the lips will be blue. You get it now? So there will be reduction in GFR. Yes, there will be reduction in GFR. Why? Because there's no blood. Remember, you need at least 1,300 ml going to 2,000 ml to be pumped into the renal arteries so that the GFR will increase. So at this particular point, due to a reduction in amount of renal blood flow, what happens? There will be reduction in what? GFR, because renal blood flow, at an increase in renal blood flow, there will be is directly proportional to an increase in GFR. So when there's a reduction in renal blood flow, there will also be a reduction in what? GFR. There will be metabolic acidosis, I told you, because the CO2 will be combining with its water to form carbonic acid, which split into what? Hydrogen ion, which and what? Bicarbonate, causing metabolic what? Acidosis. There'll be hypercapnia, I said it, because there'll be increase in CO2. There'll be hyperventilation, because now what happens? Immediately there's metabolic acidosis. What happens? The body will try to remove the CO2 to compensate for acid-base balance. So there will be removal of CO2 from the body. Are you getting now? So that removal of CO2 will cause there will now be respiratory alkalosis. So the lungs has to become alkalized so that CO2 has to remove, because there's high amount of CO2 in the tissue. So to compensate for it, there will be hyperventilation, whereby removing all CO2 from the body. Oligouria. Why would there be oligouria? There's reduction in renal blood flow, there's reduction in GFR, so nothing is being filtered. there'll be what? Oligouria, which is the first sign of acute kidney injury. So the kidney will now be damaging small. There'll be oligouria, because when there's oligouria, there's nothing to be filtered, and the body is trying to conserve all the fluid it has. So instead, as it's trying to conserve all the fluid it has, instead of it to remove it, he will store them, causing oligouria. But the kidney now is in acute kidney injury now. Neurological deficit. Why? Because now pressure is needed to pump blood through the carotid vessel, but there's no pressure now. Every vessels are vasodilating. What happens? The brain will start to protect itself by Cushing reflex, which might not be enough, and it tries to protect itself by Cushing reflex, which is not enough. What happens? You start sabotaging itself. So some structures in the brain, some gyrus will not be receiving blood. What happens? There will be what? Focal neurological or generalized neurological deficit, leading to either stroke or any brain damage. So I've given you and explained the clinical manifestation and features of what? Circulatory shock. What will happen when there's circulatory shock? So the question you ask yourself, what are the types of circulatory shock? So the first one, you have what they call hypovolemic shock. You get it now? So the next one, you have what they call vasogenic shock, and the last one, you have what they call cardiogenic shock. So there's a hypovolemic shock. Naturally, sometimes they remove this vasogenic shock and distributive shock in different way, and there's cardiogenic shock. But let me put it into these three: hypovolemic shock, vasogenic shock, and what? Cardiogenic shock. Very, very important. So now look at a normal blood vessel. You see a normal blood vessel, the capillary diameter is very low. So the capillary diameter is very low, which means when oxygenated blood is coming, nutrients lesser than about 0.1 micrometer can now enter. But if you are greater than it, you cannot enter. Like plasma protein, the diameter of plasma protein is high, which means plasma protein cannot pass through. You get it now? So anything that is higher than the normal fenestration point or fenestration opening of the capillary, we stay inside the blood. But at this particular place, what happened? Look at the second video. The capillary permeability is not high because we need fluid. We need fluid to be moving from the tissue into the blood. So you get it now? So it's very, very important now. So moving on now, we'll be starting with the first one, what we call hypovolemic shock. You get it now? So I'll talk about everything in this video. I don't want to split it into two, so you just watch it. In hypovolemic shock, what happens now? This results in when there's a reduction in blood volume. Hypovolemia, hypovolemic shock. So when there's a reduction in blood volume, what happens? This is as a result of a reduction in cardiac output. Very, very simple. Shock can be as a result of anything. Shock can be as a result of a reduction in blood volume. It can be as a result of what? A damage to the sympathetic blood flow or the autonomic nerves. It can be as a result of what? A heart is damaged. It can be as a result of what? Infection. It could be as a result of allergy. So anything can cause shock. But in this hypovolemic shock, it is telling you that this shock was as a result of a reduction in blood volume. So a reduction in blood volume, which means something is making the blood component to be low. We don't know what is making the blood component, because naturally the blood capacity is 5 liters. So if the blood capacity is 5 liters, which means something is reducing the volume, because naturally 5 liters is supposed to be sent out and 5 liters is supposed to enter. So something that makes 5 liters that is going out to not come back again is a problem. Again now, so something is reducing the movement of blood, something is reducing the blood capacity, something is reducing the blood volume. So when the result of a reduction in blood volume is causing the shock, we call it hypovolemic shock. And for there to be hypovolemic shock, which means the cardiac output has to have reduced. And what causes a reduction in cardiac output? Which is reduction in venous return. So the reduction in venous return is high. There's a high reduction in venous return, and since there's a reduction in venous return, there's also reduction in heart rate, reduction in stroke volume, reduction in cardiac output, and also there'll be a reduction in arterial blood pressure. So there'll be a reduction in everything. The only thing that will be firing excessively is the heart rate, and not that the heart rate normally is increasing. It's called the reflex tachycardia. So it's just a reflex sign because of the pressure is low. So the heart has to be beating fast in order to move small amount of blood. But in doing this, it's eating up all the oxygen. So hypovolemic shock is the result as a reduction in blood volume. So when the shock is as a result of blood reduction in blood volume, we call it hypovolemic shock. So what can cause a reduction in blood volume? It could be hemorrhage. So hemorrhage can cause. So when you are bleeding excessively, excessive bleeding decreases the normal volume of the blood, which is supposed to be 5 liters. So when you reduce the blood to about 3.5 liters due to all the blood has come out, it could be internal bleeding, it could be external bleeding. External bleeding could be outside, or it could be internal bleeding causing hematoma. Okay, now, so it depends. It could be hemorrhage, it could be burn. So remember, when fire is burning, what happens? Heat. Fire burns the tissues, thereby decreasing the water. It decreases the water by drawing out all the water, because what fire does is that it creates high amount of heat that increase sweat that draws out all the water. Are you getting me now? So it draws out all the water because the fire burnt place, the tissue that has been burned, sucks water. You get that? So the next one is vomiting. When you vomit, what happens? You are not only vomiting the food, you are vomiting liquid too. Because when you eat, what happens? You drink water, and immediately you are vomiting excessively. What happens? You are also losing water, and when you lose water, what happens? You are also decreasing the blood volume, which can lead into hypovolemic shock. When you are taking diuretics, so what are diuretics? Diuretics are drugs that you take, and what does diuretics do? They make you urinate. It could be osmotic diuresis, whereby your body is removing the water because it has high amount of water. But when you start taking diuretics, or maybe you have DKA, diabetic ketoacidosis, when your body's acid-base balance is reduced, and when the body's acid-base balance is reduced, and there's much more ketone bodies in the blood, what happens? You will be urinating because your body is not balancing its acid to base very well. You get it now? So when it's either you are taking diuretics that is allowing you to urinate too much, because diuretics, you urinate all your liquid because your body is not even allowed to water reabsorb. It's only allowed to excrete, and when you are excreting, what happens? You are reducing water, and when you are reducing water, what happens? Your blood volume reduce, causing what? Hypovolemic shock, diarrhea. So what happens in diarrhea? What happens? You are stooling out blood, or you are stooling out fluid. Sorry. Now there's low contact time. Your peristalsis is high. Your contraction and relaxation of your GIT tract is high. So when your contraction and relaxation of your GIT tract is high, what happens? There's low amount of contact time. The food that's supposed to be absorbing in the small intestine is not absorbing. So they are passing out very fast because of increase in the motility and secretion in the GIT tract. You get it now? So you get it now. It could be hemorrhage when you lose blood. It could be fire, burn. It could be vomiting when you are removing food and water. It could be the use of diuretics or osmotic diuresis, whereby you urinate blood due to imbalance of acid base, or it could be diarrhea. So the diarrhea there is that you are removing your food and your liquid through your anus due to increase in peristalsis movements. So what is the pathophysiology of hypovolemic shock? Now, first of all, one thing you have to know that first of all, for you to have hypovolemic shock, there have to be a reduction in blood volume. So a reduction in blood volume, what will it cause? A reduction in blood volume will cause a reduction in what? Venous return. So a reduction in blood volume causes a reduction in venous return. So when it causes a reduction in venous return, what happens to the heart rate? The heart rate will be reduced, but there will be a reflex tachycardia. The heart rate will reduce, the stroke volume will reduce, the cardiac output will reduce. There's already a reduction in blood volume, so your blood volume is low, so your body doesn't have blood, which means the venous pressure will reduce. He is not bringing anything into the right atrium. So when he's not bringing anything into the right atrium, what happens? The cardiac output is reduced, the stroke volume the heart rate is reduced. Are you getting me now? So also due to this particular point, there will be vasodilation of the blood vessel. Are you getting me? Causing hypotension. Then what happens? Naturally, due to the fact that the bioreceptors are located in the coronary carotid sinus. So since they are located in the carotid sinus, and they are usually primarily stimulated by an increase in blood pressure. So the bioreceptors are located in the carotid sinus, and their work is that they are sensitive to an increase in blood pressure. But now the blood pressure there is low. The blood pressure is low, so you don't have an increase in blood pressure, because the pressure in which the blood is moving is already reduced because there's vasodilation. So what happens now? There will be an inhibition of the bioreceptors. Instead of there should be activation of the bioreceptors, there will be inhibition of the bioreceptors. Now the inhibition of the bioreceptors is causing the brain to send an information to the vasomotor center. You get that? So listen, naturally, what stimulates bioreceptors? Bioreceptor is stimulated by an increase in blood pressure. Why? Because the bioreceptors are located in the lateral wall of the carotid sinus, and they are usually stimulated when they are stretching, when the carotid sinus stretch. But this one, the blood pressure is already low, so the carotid sinus cannot stretch. So instead of there to be activation, there will be inhibition or firing of the bioreceptors, and this inhibition of firing we send an afferent signal to the vasomotor center through the vagus nerve and the glossopharyngeal nerve. So due to this information being sent to the glossopharyngeal nerve and the vagus nerve, what happens? They will go to the nucleus of tractus solitarius. So when they reach the nucleus of tractus solitarius, what happens? They will do something now. The nucleus of tractus solitarius will inhibit the cardioinhibitory center and activate the cardioaccelerating center. So go watch my video on the regulation of arterial blood pressure. So immediately now in the vasomotor center, the nucleus of tractus solitarius is stimulated, because who is bringing the signal? The afferent fibers of the glossopharyngeal nerve and the vagus nerve. These people bring an information. They bring an information that there's a reduction in the blood pressure. So there's a reduction. So they are bringing this information of a reduction in blood pressure due to the inhibition of the bioreceptors. So when they go to the nucleus of tractus solitarius, the nucleus of tractus solitarius will inhibit that permeability, the cause of the permeability, which is parasympathetic. They will inhibit parasympathetic, because parasympathetic always cause vasodilation to the M2 and M4. So there will be inhibition of vasodilation to the parasympathetic. So the cardioinhibitory center will be inhibited, and there will be stimulation of the cardioaccelerating center. So the cardioaccelerating center will be activated. So when the cardioaccelerating center is activated, there will be increase of sympathetic discharge. You get that? So now, due to the inhibition of the bioreceptors, what happens? The glossopharyngeal nerve and vagus nerve will send it to the nucleus of tractus solitarius of the vasomotor center. It will now inhibit cardioinhibitory and increase cardioaccelerating, thereby increasing sympathetic discharge. So that is sympathetic discharge releases two things: noepi, epi, and dopamine. So noepi will do what? Bind to the alpha receptor, alpha 1 receptor, basically of the blood vessel, vasoconstricting it, increasing the blood pressure. Why sympathetic? Why epinephrine will bind to the beta receptor, usually beta 1 receptor on the blood vessel, binding to the beta 1 receptor on the heart, causing contraction of the heart. So now we are causing contraction of the heart, so that the cardiac output will increase, so that the stroke volume will increase. Yeah. Also, the catecholamine is also released in the reticular formation, producing restlessness and apprehension. Are you getting me now? Are you seeing it now? Also, during tissue hypoxia, what happens? Look at it. In tissue hypoxia, always remember that when there is hypoxia, due to that the myocardium is constricting too fast, and as they are constricting too fast, they are using up all the oxygen, and as they are using up all the oxygen, they are producing a byproduct called CO2. And when they produce a byproduct called CO2, what happens? That CO2 that they are producing, we bind with water, forming carbonic acid, increasing the acidity level, so the pH level will drop. And as the pH level drops, what happens? There will be lactic acidosis. Why? Because instead of going from glucose to pyruvate to acetic-CoA, they are not going from pyruvate to acetic-CoA, they are moving from pyruvate to lactate. So there will be lactic buildup. So if you check the cardiac enzyme, what happens? The lactate level will be high, showing that there is acidosis. So now there will be metabolic acidosis, and to save the patient from metabolic acidosis, what happens? The body will do what we call hyperventilation. So I will remove all the CO2. Are you getting me? I will remove all the CO2. So now what happened? Due to hypoxia, hypercapnia, and acidosis, what happens? This is a prime stimulator of chemoreceptors. So this is the blood constituent that stimulates the chemoreceptors. And the chemoreceptors are present in the what? Carotid body and the aortic body. So in the carotid body and aortic body, when there's hypoxia, hypercapnia, acidosis, what happens? They'll be stimulated. And when they're stimulated, do you know what they do? They go through the glossopharyngeal nerve and the vagus nerve. So when they move to the afferent fibers of the glossopharyngeal nerve and vagus nerve, what do? They stimulate the nucleus of tractus solitarius, and the nucleus of tractus solitarius do the same thing. Inactivate the cardio inhibitory center and activate the cardio accelerating center. So when they do that, so they increase the blood pressure. And also the peripheral chemoreceptors, what do now? The peripheral chemoreceptors also increases what? Inspiration. So there's peripheral chemoreceptors for respiration, the same way there's peripheral chemoreceptors for blood pressure. So the peripheral chemoreceptor is the same thing: hypoxia, hypercapnia, acidosis. But when these three are lined up, which means what happens? The vasomotor centers will be stimulated, which will help to increase the blood pressure. But also, especially hypoxia. So when there's hypoxia, what happens? Due to low amount of oxygen, what happens? The potassium channel that is sensitive for oxygen, which we call the oxygen sensitive potassium channel, will be closed. And when the oxygen sensitive potassium channel is closed, what happens? Sodium will what? Enter, because there will be reduction in efflux of potassium. So potassium cannot be effluxed out. So since potassium is not allowed to be effluxed out, what happens? There will be increase in depolarization of the cell. So the increase in depolarization of cell will send an afferent signal to the dorsal group of neurons. So if you go to my video, I explain the regulation of respiration. So in the regulation of respiration, there are two. You have the central chemoreceptors, you have peripheral chemoreceptors, and we have neural receptors. So in the neural receptors for respiration, I talked about it. Why in the neural regulation of respiration, I explained that one. And also the chemical regulation of respiration too. That's where we have chemoreceptors. But now in this peripheral, for you to have peripheral chemoreceptors, these are sensitive to basically hypoxia. So when there's hypoxia, what happens? There will be reduction in potassium efflux. So the oxygen sensitive potassium channel will be inactivated in the glomal cells. So the glomal cells are these cells that are responsible to send afferent signals and to be sensitive anytime there's reduction in oxygen. So that reduction in oxygen will do close the potassium channel. So potassium cannot leave the cell, especially the glomal cells. Now this sends an afferent signal. So this depolarization of the Henry's nerve will send an afferent signal to the dorsal group of neurons. So what does the dorsal group of neurons do? Their work is to increase in ventilation. So there will be increase in respiration. So that ventilation will cause an increase in oxygen entering into the tissue. That increase in oxygen into the tissues will do compensate for the CO2 that has been lost. Because anytime there's increase in CO2, what happens? There'll be a reduction in oxygen. And anytime there's a reduction, anytime there's an increase in oxygen, CO2 will reduce. Because oxygen usually binds to hemoglobin when there's low CO2, and CO2 binds with hemoglobin when there's low oxygen. So this is what will happen. You get it now? So remember, hypoxia, hypercapnia, acidosis stimulate the peripheral and central chemoreceptors to increase in respiration. Also, the harass mechanism too will be activated. Why will the harass mechanism be activated? Why? Because I want to increase epinephrine on the blood vessel to do vasoconstrict. I want to reabsorb sodium. I want to reabsorb water. So because when I reabsorb sodium and water, the increase in the blood volume, and when they increase the blood volume, what happens? This increase in this reduce the risk of hypovolemic shock. So I want to increase water, I want to increase sodium, I want to increase nutrients so that the blood volume will increase, so that I will prevent shock. Also, there will be about 24 to 36 hours. What happens? There will be capillary shift. Remember I told you. Now there's more solutes inside the blood. There are more solutes than solvents. So water content in the blood is reduced. It's only plasma protein, blood cells and co that are there. So due to this particular point, what happens? Due to a reduction in water, there will be increase in osmotic pressure where? Inside the blood. Due to this increase in osmotic pressure inside the blood, fluid will now be flowing from ICF, which is the intercellular fluid, will be moving from the ICF to the ECF. So we want to draw water from the tissues into the blood. Why? Due to an increase in osmotic pressure in the blood. So due to this osmotic pressure, fluid will now be moving from the ICF to the ECF so as to compensate with the blood volume and to increase it so that it can normalize. So we call this what? Hypodilution. So the hemodilution is when there's a capillary shift exchange between the tissue and the blood so as to increase the blood volume. So don't forget hemodilution. Due to persistent tissue hypoxia, erythropoietin is what released from the kidney. Remember, erythropoietin is the prime protein that stimulates the increase of RBC formation. So RBC formation will be what? High. Why? Because of erythropoietin. Why? Because there's hypoxia. And remember, anytime there's hypoxia, what happens? Erythropoietin will be secreted from the what? Kidneys. And when they are secreted from the kidneys, they bind to their receptor, the erythropoietin receptor on the bone marrow. And when they bind to the erythropoietin receptor on the bone marrow, what happens? Simple. The same thing now. There will be what? The hematopoietic stem cell will start increasing RBC, white blood cell, and platelets. You get that? But basically, since it's erythropoietin, what happens? RBC will be increased. Why? Because the erythropoietin binds to the erythropoietin receptor on the what? Bone marrow. So when they bind to the erythropoietin receptor on the bone marrow, what happens there? It increases this activation of the hematopoietic stem cells, which are important in increasing what? Red blood cell formation. You get it now? So very, very simple. So erythropoietin production due to hypoxia, because hypoxia stimulates erythropoietin release from the peritubular capillaries of the what? Kidney. Now, what is the compensatory mechanism? I told you the compensatory mechanism here is one. To increase blood pressure, what happens? You have to stimulate sympathetic release. I get it now. So sympathetic release have to be high. So epi will bind to the blood vessel, constricting the blood vessel, increasing the pressure. Epi will bind to the beta receptor in the heart, constricting the heart to increase cardiac output. So this is how you compensate for it. Also, hemodilution must also occur. Erythropoietin must be increased. So all these things helps you to what? Increase the blood pressure, increase the venous return, increase the cardiac output, and increase what? Reperfusion. The next one we'll be talking about is vasogenic shock. So we can call it vasogenic or distributive shock. So what is vasogenic or distributive shock? Now this is a type of shock that is the result when there's inadequate tissue perfusion due to marked excessive vasodilation and increase in what? Vascular capacity due to a fall in venous return. So now what happened? Vasogenic vessel that causes shock. Vasogenic shock. You get it now? So in vasogenic shock, what happens? There's persistent vasodilation. There's continuous vasodilation. Naturally, when there's vasodilation, the body is supposed to come back and vasoconstrict to increase blood pressure. Something is happening that there's a reduction in vascular water resistance. So vascular resistance is low. And anytime vascular resistance is low, there will be vasodilation. And also the capillary will be what? Permeable. And anytime the capillary is permeable, what happens? There will be what? Reduction in what? Blood pressure. Yeah, now. So in what? Vasogenic shock, this is a shock that is caused when there's excessive and persistent vasodilation of the what? Blood vessel. You get that? So something is happening why the blood vessels are vasodilated. The next one is the causes. So what is the causes of vasogenic or distributive shock? One is what? Sepsis. Now sepsis can cause the shock. How can sepsis cause the shock? Sepsis here is when there's infection. And really, when infection occurs, what happens? There will be what? Vascular permeability. The vascular permeability is due to the increase in pro-inflammatory cytokines. So what are the pro-inflammatory cytokines and vasodilatory toxins? You have histamine from the mast cells. We have bradykins. We have leukotrienes from the membrane phospholipids. So the membrane phospholipid, we produce arachidonic acid, which will produce leukotrienes. There will also be what? Prostacyclin, which will also vasodilate the blood vessel. Are you getting now? All these things will occur. Even interleukin, cytokines will be released. And when they are all released, what happens? They will vasodilate the blood vessel, increase the vascular permeability so that white blood cell to go to the site of infection and what? Phagocytose the what? Antigen or the pathogen and kill them. So the reason doing sepsis, what happens? So sepsis is as a cause of what? Infection. when vasodilatory toxins or cytokines are released, which opens the capillaries, open them so a white blood cell can pass through. Why? Because white blood cell has a bigger diameter. So since they have a bigger diameter, they cannot pass through what? Capillaries, because the capillary fenestration is small. So if they are open, what happens? White blood cell can migrate easily. You get it now? So that is what causes. So when sepsis occur by causing the capillary to open, and that drops the blood pressure, because also there will be vasodilation of the blood vessel. There will be increase in the hypothalamic set point. So when there's changing in hypothalamic set point, there will be fever. And since there's fever, there will be chills. Since there's chills, there will be different things. Also, the bronchus begin to constrict. The bronchus will begin to constrict. Now, reducing what? Ventilation. And this reduction in ventilation will even cause hypoxia. So now, this is sepsis. So the first one is sepsis, which causes septic shock. So when a patient is in septic shock, what happens? You know that the patient is on vasogenic shock, because infection is causing the reason why the vessels are vasodilated. The next one is anaphylactic shock. Anaphylactic shock, which means the patient is sensitive to an allergen. So allergen are substances which, when they enter into the body, they provoke high and rapid inflammatory response. We call it hypersensitivity, which means your body is sensitive to something that when it enters into the body, it causes a rapid and enormous inflammatory response. So are you getting now? So hypersensitivity. So when an allergen, which is a substance that your body is sensitive to, when it enters into the body, it binds to receptors to stimulate IgE antibodies. So IgE antibodies is stimulated. So when they stimulate, IgE antibodies binds to its receptor on the mast cells. So when it binds to the receptor in the mast cells, there's degranulation of the mast cells. So the mast cells will break down, releasing what? Vasodilatory toxins like what? Histamine, bradykines, leukotrienes, and all other people. And when they go into the body, what do? They are vasodilatory toxins. They increase vascular permeability. They increase it. They vasodilate the blood vessel. What do? They migrate white blood cell to the site of injury. They causes fever by increase the hypothalamic set point. They cause what? Myocardial depression. Why? Because blood cannot flow into the heart muscles. They infect the heart muscles. Are you getting me? Causing endocarditis, myocarditis, pericarditis. Infection, reducing the amount of oxygenation that the tissues are getting, and these are bad. You get it now? That's anaphylactic shock. The next one is neurogenic shock. In neurogenic shock, something occurs whereby the autonomic nervous system, we call it autonomic dysfunction. Due to this autonomic dysfunction, the sympathetic innervation is lost. So the sympathetic innervation is lost. And when time the sympathetic innervation is lost, what happens? There will be vasodilation of blood vessel. Are you getting now? Since there's vasodilation of blood vessel, what happens? Due to sympathetic helps us to vasoconstrict, parasympathetic helps us to vasodilate. So anytime there's now vasodilation, there will be hypotension. Are you getting now? This will cause enormous fever, constriction of the bronchus. Blood supply to the tissues will reduce due to the sympathetic activation is lost. So sometimes trauma can cause the sympathetic activation to be low. You get it now? So no catecholamines, no epi, and others. You get it now? So the next one is cardiogenic shock. So we have talked about vasogenic shock, which is what? Septic, anaphylactic, and what? Neurogenic shock, whereby something occurs that damages the innervation to the blood vessel, causing what? Vasodilation and what? Vascular what? Permeability. But now the next one, which is cardiogenic shock. In cardiogenic shock, now the vessels are not affected here, the blood volumes are not affected here. Something is damaging the heart. So the heart is being damaged now. So the heart that pumps blood cannot pump blood again. The vessels are fine, the blood volume is normal, but the heart is not pumping enough blood. And since the heart is not pumping enough blood, so this one now is central issue, it's not peripheral issue. Are you getting it? It's not other component. This one is the heart that is not pumping blood. Are you getting it? So it could be structural damage to any of the part of the heart. So it could be myocardial infarction, which means the heart wasn't collecting enough oxygen, causing coronary artery disease, causing what? Angina pectoris, causing what? Myocardial ischemia, before causing myocardial infarction, which is causing death of the myocardium. So the myocardium are dead. So if the myocardium are dead, what happened? The cardiac muscle fibers cannot contract. And if they cannot contract, there's no cardiac output is reduced, the stroke volume is reduced. So the next one is severe arrhythmias. Severe arrhythmias, when there's excessive tachycardia, the heart is beating too fast, taking up all the oxygen. There's something that occurs, maybe the conduction system of the heart is low, which means the SA node is not firing well, the AV node is not firing well, the bond office is not firing well. So there's what severe arrhythmias. There's myocarditis. What's myocarditis? Infection to the myocardium. So the myocardium is infected, which means it's not taking up oxygen. Are you getting now? So the myocardia are infected. There's congestive heart failure. The congestive heart failure in which the valves are affected, or there are conditions where the ventricles are hypertrophic, or they are restrictive, or they are infected, whereby they cannot pump blood very well, causing blood to be going back, or fluid to be going back to the lungs, causing pulmonary edema, causing jugular distension, causing what? Hepatomegaly, causing ascites, because these are cause of congestive heart failure. Also, there's severe cardiomyopathy. Are you getting now? Severe cardiomyopathy. So now we have talked about the hypovolemic shock, we have talked about the vasogenic shock, we have talked about the cardiogenic shock. What is the reversible or refractive stage of shock? So when you cannot bring them back to their site, when you cannot resuscitate them back, what happens? There will be severe hypotension. So when you cannot resuscitate them back and there's excessive reduction of blood pressure, there will be severe hypotension. And since there's severe hypotension, the tissues, the myocardium will not be receiving blood. And when the myocardium is not receiving blood, there will be myocardial depression due to prolonged hypoxia. Remember, due to excessive tachycardia, what is happening? The heart is beating too much. Now, it is using up all the oxygen. There's lactate level have increased. So since lactate level have increased, oxygen level drops, there will be myocardial ischemia. Ischemia due to a low amount of blood that has been supplied there. So after myocardial ischemia, there will be myocardial infarction and necrosis. You get it now? So this causes myocardial depression. You get it now? So also there will be release of endotoxins, which I've talked about, which is histamine, bradykines. Are you getting now? Which vasodilate, causes build-up of nasty amount of pathogens in the heart muscles, furthering the myocardial depression, damaging the myocardium. You get it now? Also, there will be depression of the vasomotor center, because now the blood loss is high, the sepsis is high. The presence of allergy have destroyed the body so much. Are you getting now? That the body cannot recuperate. So the vasomotor centers cannot work again. The vasoaccelerating center that's supposed to increase blood pressure is no more working again. Are you getting now? So there will be increase in capillary permeability. Fluid will still be shunting from the tissue to the blood, causing a reduction in fluid in the tissues, causing muscle wasting. Okay, now, so you suck out all your tissue, suck out all your blood, suck out everything. There will be cellular deterioration, because now metabolism will reduce. There will be reduction in metabolism here. There will be cerebral ischemia, because the brain's supposed to have saved itself through Cushing reflex, but the oxygen level have dropped, so the brain tissues are not seeing oxygen. So they will be deteriorating, there will be damaging. There could be stroke, there could be damage of focal or generalized neurological deficits. There will be stroke, there will be renal tubular necrosis, because even the kidney itself will not be supplied by any blood. Again, so there's already a reduction in renal blood flow, causing a reduction in GFR. Now, the blood that is even supplying the renal tubules will be low, causing renal tubular necrosis, because they will start dying. And eventually, the patient will die. So this is as a result of irreversible refractive stage of shock, when you cannot bring the patient back. This occurs when about 15 to 20% of the blood is already lost. What are the treatments of shock? So the next one is the treatment. Naturally, let us go back. Use your head. Anytime there's hypovolemia, what can you do? You do a blood transfusion. So you increase the normal blood volume. The blood volume is low. So what can you do? You do a blood transfusion. So you bring in all the whole cells and all the whole nutrients needed for the blood. So there will be blood transfusion to increase the blood count. There will be plasma transfusion, because naturally blood cells will be transferred differently, and blood plasma, which is FFP, will be transferred differently. So you will bring in the blood plasma. So at the blood plasma, we increase plasma protein, and plasma protein are very, very important. So there will be blood transfusion for normal blood cells. There will be what? Plasma transfusion to increase plasma protein and other important plasma nutrients. There will be plasmapheresis to bring in plasma. So plasmapheresis is a technique used to what? Remove bad plasma and bring in good plasma. Because some plasma proteins like antibodies can damage the tissue. So in plasmapheresis, we bring in good plasma. Are you getting me? From a donor and bring out the patient's bad plasma that could be damaging the body. There'll be administration of symptomatic drugs. Are you getting me now? Yeah, symptomatic drugs are alpha 1 or alpha channel drugs that when you give it to the patient, it can increase vasoconstriction of the blood vessel, like phenylephrine, like midodrine. These are what alpha 1 agents that increase blood pressure when there's what? Hypotension. You have beta 1, which is dobutamine. There's isoproterenol. These are drugs that increase the heart rate. You get it now? So they increase the heart rate, increase the cardiac output. So the first one, phenylephrine, midodrine, they increase what? The blood pressure. I get them now. Why both dobutamine and isoproterenol increase the what? Heart beat, increase the heart rate, increase the cardiac output. Also, the patient needs oxygen therapy, which is always the first thing you even do before you start administering blood transfusion. You first of all always make sure the patient is breathing well, and also give an oxygen mask, deliver oxygen to the tissue so that the brain will be saved, so that the myocardium will be saved, so that the body's tissue will not die. Also, you position the patient very well in what we call a cardiac line. A cardiac line, make sure the head is and the legs are elevated so that blood venous return will increase. Are you getting me? Also, you not treat the underlying treatment. You also treat the underlying cause. The underlying cause is very, very important, because with the underlying cause, it's usually easy to not track. If it's sepsis, you give antibiotics. Are you getting me now? If it's anaphylactic shock, you give epi directly. If it's neurogenic shock, or maybe something is causing space occupying lesion that is damaging the sympathetic nerve, you also treat it. If it's vomiting, diarrhea, you give anti-diarrhea medication. If it's burn, you debride the patient and all those stuff. Very, very important. So now, one thing you have to know now is that during hypovolemic shock, in the hemodynamics changes in different type of shock, what happens? During hypovolemic shock, what happens? The blood volume decreases, the venous return decreases, the cardiac output decreases, the peripheral resistance, what happens? It also decreases. Yeah, so this one you have to correct it. The peripheral resistance decreases, the blood pressure decreases, the heart rate increases because there's reflex tachycardia. The central venous pressure also decreases because of the venous return have already decreased. The urinary output also decreases because the body is retaining the fluid that is needed for what? Circulation. So we don't want to throw away fluid to urine. We want to conserve them. In vasogenic shock, what happened? The blood volume is normal. The blood volume is not the problem. The venous return is reduced. Why? Because the central venous pressure is reduced. The cardiac output at this particular point is also increased because nothing is happening to the heart. The heart is fine. The vascular resistance is reduced. Are you getting me? Because something is causing the resistance to reduce, and there should be hypotension. The blood pressure is also reduced, but the heart rate is increased. Why? There's a reflex tachycardia because of hypotension. The central venous pressure also is reduced because of there's vasodilation of the blood vessel, and urinary output is also reduced too. Why? Because excessive dilation reduces excessive dilation of the renal blood vessel does what? Reduces what? GFR. In cardiogenic shock, what happens? The blood volume is normal. That is not the problem. The venous return has reduced. Why? Because the heart is not even pumping enough blood or receiving blood so much. The cardiac output is reduced. The peripheral resistance is increased. The blood pressure is reduced. So all these things are very, very important. Yeah. So I hope this all made sense to you and you have understood everything I talked about in the circulatory shock. So I explained it very well. I gave you instances. I gave you the reasons why everything is occurring. So one quick note you have to know. So shock is a medical emergency that requires what? Early and quick proper treatment. If not, it will cause so many damage that is not good. And you have the restoration of the circulatory volume. You have to restore the volume. You have to maintain perfusion and treat the underlying cause. So one thing you have to monitor the vital signs. Check the heart rate, check the blood pressure, check the temperature. All these things are very, very important for you to check. Also, the urine output. Check whether there's hematuria or the polyuria or there's oligouria. You check the mental status of the patient. Why? Because the brain is not receiving oxygen. Check check the cardiac enzymes very well to check for lactate. You get it now? So now if you delay treatment, it will damage the body very well. You get it now? So I hope it all makes sense to you and you have understood everything we have talked about in the words circulatory shock. So I've talked about everything here. If you are new to my channel, make sure to subscribe and turn on your post notification button, so anytime I drop any video, you'll be sure to be notified. If you want me to make a video for you, drop it down in the comment section. I promise I'll make the video for you. Yeah, so we're ending this lecture to time and we'll be talking about cardiac arrhythmias in the next video. Bye bye.